PSI, my scene is safe. I have one patient. It is a mechanism of injury. I'm considering C-spine and calling ALS and fire for backup. Hi, my name's Angela. I'm going to be your EMT today. What's going on?
I got hurt and fell on the stairs.
Where are you hurt?
My back hurts and my knees are bleeding.
Okay, can you tell me your name?
Michael.
And how old are you?
15.
I'm going to ask you a few silly questions. Do you know where you are?
Home.
What time of day is it?
Night.
Who's the president?
Trump.
So I'm going to ask my partner to hold C-spine. For my general impression, I have a 15-year-old male who's alert and oriented ×4 with a chief complaint of injuries from a fall. My patient's airway is open, clear, and maintained. I'm going to examine his breathing. I need to expose the chest, look for any injuries. There are no injuries. I'm going to palpate the ribs. Is it okay if I check your chest?
Yes.
I feel no crepitus or deformities. However, I feel paradoxical movement. I'm listening to 2 lung sounds. You can take a deep breath for me. And another. I hear flail chest, so with the help of my partner, I'm going to administer 15 liters of oxygen per minute via BVM. I'm going to ensure that my patient receives adequate ventilations. Now, I'm going to check his circulation. Is it okay if I check your pulses?
Yes.
My patient's pulses are strong. It's okay if I feel your forehead?
Yes.
My patient's skin condition is pink, warm, and dry. I'm going to check the voids for any blood. I notice no blood besides there's blood on his knees. Now I have a high priority patient. I'm going to update oncoming EMS and oncoming ALS and fire. Now moving on to my rapid body scan, checking the skull for fractures, no fractures, checking the neck for any tenderness or swelling or deformities, negative GVD, negative tracheal deviation. I'm going to help my partner and apply a collar around his neck. I am going to check the chest again. I still feel that paradoxical movement. Going to listen to 4 lung sounds. Take a deep breath for me. And another. Going to palpate the abdomen. His abdomen is soft and supple. Checking pelvic stability. His pelvis is stable. Now I'm going to check his arms and his legs. Going to palpate and inspect them. Do you feel any pain anywhere?
Just my back and my knees.
Any other pain?
No.
Now I'm going to check his back and log roll him. With the help of my partner, I'm also going to put a backboard behind him. I'm noticing some bruising on his back. I'm also inspecting the buttocks. My patient's on a backboard. Moving on to sample. You feel any other pain anywhere?
Nope, just my back and my knees.
Okay, do you have any allergies?
Nope.
Do you take any medications?
No.
Any blood thinners?
No.
Do you have any medical history? Any medical problems that you know of?
No.
When was the last time you ate something?
2 hours ago.
And what were you doing when you got hurt?
I was on my phone walking down the stairs, but I missed a step.
Okay. I'm going to check his vitals. My patient's blood pressure is 110/62. patient's blood pressure is a little low. Let's check his heart rate. My patient's heart rate is 88. It is regular and normal. Checking for respirations now. My patient's respiratory rate is 22 breaths per minute. So that is a little fast and not normal. Now I'm going to check his pupils. My patient's pupils are pearl, and I'm going to check his skin condition again. My patient's skin condition is pink, warm, and dry. Now moving on to my next assessment, I'm checking the skull again for any fractures. Checking his ears for CSF. No CSF. Can you open your mouth for me? Checking his nose. Now I'm checking his neck again. Through the collar. I'm going to palpate his ribs. And I'm listening to 6 lung sounds. Take a deep breath. Now I'm going to palpate his abdomen in 4 quadrants. His abdomen is soft and supple. I'm going to check the pelvis again for stability. And if there's need, I would check for any injuries to his genitalia and look for priapism. I am going to inspect and palpate his arms and legs. Check PMS. Can you wiggle your fingers for me? And close your eyes. What finger am I pinching?
Pointer.
What finger am I pinching?
Pinky.
Checking his pulse. Pulse is strong. Palpating the legs, inspecting the legs. I only see bleeding on his knees. Can you wiggle your toes for me?
Yes.
Close your eyes. Which toe am I pinching?
Toe.
The big one?
Yes.
Which toe am I pinching?
The big one.
What about this one?
The pinky one.
Okay. I'm checking pulse. Pulse is strong and present. I am going to now, I'm going to check his spine again. Check for any other injuries. Okay. And he's going to be on the backboard and we're going to transport him. Now again, as restating my general impression, I have a 15-year-old male, learn oriented ×4, with injuries to his back and knees. For his knees, I'm applying 4x4s so the bleeding can stop. He is on oxygen with 15 liters per minute via BVM. He has a cervical collar on, and I'm going to update my oncoming crews, and we're going to reassess every 5 minutes since he is a high priority patient.